So I am doing a lateral wall sinus lift in this one. Need about 6 or 7 millimeters of bone for implant placement in this area. And just basically made kind of like a modified semi-lunar type incision, and then just using the Woodson to lift the flap up. It's nice when it comes off pretty easily like this. You can just get your Minnesota under it. The hardest part of these things is keeping that flap reflected nicely the whole time, because I'm right-handed and I'm doing that with my left hand the whole time. Basically now just taking a lab burr, like a barrel-shaped burr, and going in at 40,000 RPM. Usually when I section teeth, it's at 80,000 RPM, and I just kind of cut it in half when I do these so I can control it a little bit better. And then I'm also coming off the foot pedal quite a bit, so I'm not going full speed a lot. Just kind of gauging how deep it's cutting, how it feels, and so forth. Now I'm getting down to the membrane. You can see the color change there. And so what I'm trying to do is basically make the window wide enough for the bone syringe, essentially, to be able to push graft in nicely. That's just about as wide as I really need it. And I use this little disc to see where I'm at. I'm going to push it in a little bit, push the membrane in, and then I can feel the bottom floor has a little lip to it, so I know I can remove a little bit more bone to get down to that floor. Gives me a little bit of extra room to put my graft in. Almost there. Now you just get your favorite sinus instruments, and usually you buy a set of these things and you just kind of see which ones work for the case depending on which side of the face you're on, or the access point, the anatomy, and so forth. So I found a couple that I think would work, and I'm kind of stick with those. Basically putting it in gently, pushing the membrane out, or actually in this case. But I'm also putting it to the floor of the sinus where I can feel the bone, and then pushing out after that. That way it's less likely to perforate or tear the membrane. Once I feel like I got enough space for grafting, I'll go ahead and put the graft in using a syringe, usually in these cases, just to push it in. Just about there. I got good recoil there, and I can feel it. It's not perforated. So now that window is just about the size of that syringe, so now I can just kind of inject in and then kind of push it in and use your instrument again to get that graft in place. Once you push it in, you're going to basically inject more and kind of do this over and over until you got enough for the space. It gets a little monotonous, I know, and so basically we're just going to keep doing this. I think I treatment planned about 3 cc's of allograft here, 3 to 4, and just kind of putting those in and pushing them through. I'm just going to speed through some of this stuff because it's pretty much the same thing. Graft goes in. I'm able to push it in some other way too. You see that? Where the syringe can actually push it in, which is also nice because I made my window just wide enough for that. And some of the excess on the outside, I'll just use my sinus instrument again and push that in. So I'm basically going to just keep adding some graft until I get to where I think it's enough. And it's nice, you're less and less likely to perforate the membrane as you go because that graft is kind of pushing it out a little bit and gives you a little bit more room. So when I push it in, I'm really pushing the graft in, which is also pushing the membrane from the other side of it. Looks pretty good. Clean it up a little bit. And then I'm going to use a little PRF fibrin here, and then I kind of put that in at the end. I actually put some in the beginning as well, a lot of times before I add the graft, just a little bit. Put that in at the end. I'm going to free up a little space there on that palatal side to suture to, and I'm just using a basic collagen membrane to close. And then I'm going to close. And there's your final.